Right, sir. Thank you, Manoj. At the onset, I thank Dr. Chandak sir for including me, inviting me for this sixth chapter of the Ortho Armory. Today's my topic is basically abrasion and its management. Um, the whole purpose of I think this presentation is because it is one of the commonest injury which is faced by all the medicos, and it is most commonly overlooked. We always say that if it is abrasion, it is going to heal on its own. It is presumed to be self-healing and considered to be non-sequential, but that is not the always a scenario. The purpose is also to diagnose and document these, how to document these abrasions, how to treat them, how to get better results, and how to prevent the sequelae. So what it is, a book-wise definition would be an abrasion is a superficial injuries to the skin and or to the visceral linings, resulting in the break in the continuity of the tissues, but which is limited to the superficial or the deeper layers of the skin. So it may involve dermis, epidermis, or deeper layers of the dermis. It also gives window to the underlying injuries. A careful examination of all these abrasions may tell you about how deep this wound could be. Is there a degloving injury, or is there underlying fracture, especially when we see the wounds on extremities, on the bony prominences, or on the face. So like this, if this wound is carefully, we may have to suspect if there is a fracture of zygoma or Lendewing, and that needs to be seen. So going into the classification of these abrasions, the first one is a scratch. This is generally caused by a very sharp pointed objects like fingernails, pin, or a thorn, which scratches the screen and gives you a picture like this. These generally heal without any sequelae and just need cleaning and application of antibiotics, sometimes occlusive dressings. Grazes, these are the commonest type of abrasions which we come across, for which generally the surgeons or the doctor's help is needed. The patients approach us for that. This occurs when the skin moves against a rough surface and comes in sharp contact with it. These are uneven longitudinal parallel lines with epithelium heated up at the end of the lines, and it can tell us in which direction the force was applied. These are kind of pictures that we get, but sometimes these are very deep, and we see that the epidermis, the dermis, even the deeper dermis is completely abraded, and we see micro raw areas between these abrasions, and which actually invites intervention and treatment, which could be surgical, as our routine is to treat all abrasions non-surgically just by dressings. But sometimes this may need a debridement and micro suturing. Third type is a pressure abrasion, very less commonly seen, but this is seen when there is the impact is at 90 degrees to the skin. For example, because of tying of knots, tying of strings, especially to the patients who are irritable in the bed, or because of the a ligature mark, or because of the chain of a vehicle which runs onto the a body part. It gives a pattern of that object on the body, and then they are called as a pattern abrasions. We need to mention this because it has a medical legal importance, and it gives you about the instrument which must have occurred, which must have inflicted this kind of trauma. So we should also know what is the clinical progression, or what is the natural history of abrasions. The fresh abrasion looks bright red within first 12 to 24 hours. It converts into a bright red but a brownish looking scab. It becomes more brownish by the end of 2 to 3 days, and then it becomes brownish black. At the end of generally 10 to 12 days, it peels off, giving a depigmented scar, and then which it gradually pigments, sometimes over pigments. And if it is non-sequential, it will heal without much of a scar. If it is sequential, like if it is very deep and if there are associated injuries, it will lead to an ugly looking scar. So while doing a physical examination, we should know the relevant history so that we get to know what kind of injury it is, what is the associated physical trauma. Secondary survey, it is most important. Many a times at the end of all of a surgery, we get to know, the patient tells you when the patient is shifted back, they tell us that, oh, doctor, there is another injury here. And whenever we find any abrasions in any corner of the body, we should go for a secondary survey. Look at the commonest site where these injuries occur, all the bone on the extremities, the bony prominences, the face, and try to treat them. Look at the unusual sites of abrasions. If you find abrasions over the breast, chest, genitalia, suspect some sexual assault, and then that has to be reported and has a medical legal importance. So the documentation basically includes type, size, shape, color, the location, how old the injury looks like, and sometimes the scrapings from the abrasions are useful in cases of, as I said, the sexual assaults will give you enormous information about the suspect. So the treatment of the abrasions, basically, they are forgiving injuries as generally considered, but the smaller ones which heal on their own when we provide them with a favorable environment. So when we clean them, make them free of all contaminations, give them a kind of occlusive, sometimes non-occlusive dressings, non-occlusive in the form of applying some antibiotic cream to provide some moisture for the epithelium to heal up underneath it, or an occlusive dressings, which allows a controlled environment for the reepithelialization of the wound. Larger abrasions, which are bigger, contaminated, obviously needs surgical attention. They need a good debridement under anesthesia, which needs to be done with a very good quality of instruments like scalpel and a scoop, and all the contaminants needs to be removed and washed off. We have to look into the wounds frequently, as sir said, every second or third day, and because any infection can lead these superficial injuries to become deep, and then that can lead to larger skin loss and scar formation. As I said, assessment of deeper injuries and its management should come during the progress of healing of these wounds. At the end, once these wounds are healed, it is necessary that we should provide a good sun protection, that is a sunscreen for all these wounds, because these injuries tend to get over pigmented, and sometimes an hypertrophic scars may be visible, so they may need some sort of scar treatment in the form of application of silicone gels or oils or some sort of pressure therapy. So here are some cases which I just wanted to show. That is how generally an abraded wound is seen. There is a deep wound which is visible in the center, but there are larger areas which are abraded, and if they are washed off and they are nicely debrided, they will definitely heal better. The size of the wound, so this is the same patient, so the wounds are clean and nicely debrided. So the intervening parts, which were actually just abrasions, they have healed well. And then there is a defect in the central, which was later on covered with a flap. That reduces the tissue requirement, gives much better healing. This is another patient. Now, as we see, we can see that the scab is brownish. So that means this wound is around 3 to 4 days old. There is a heap of scab there. That means that the wounds underneath could be slightly deeper. And obviously she needed debridement, and that lead to, I get to know that there is a defect here in the infraorbital region, which was covered with a small flap. And obviously there were deeper injuries which were cleaned and dressed, and eventually everything healed. But we can see that there are scars, slightly hypertrophied in the areas where there was uh, there were deeper abrasions, and they healed with some sort of sequelae also. This needed some aftercare. A similar patient needed an intervention for his fracture zygoma, which was underlying these abrasions. In addition, if we see this area, this is a deep abrasion, and this flap was degloved. That means that there is an abrasion on the top of it, as well as the wound is degloved. So less likely that this part of the skin, though it looks like only abraded, is likely to survive. So after having done the debridement, we realized that there is a skin defect, and that defect was closed with a small islanded flap, and then everything healed primarily. And that is how we followed him up for around 1.5 years. He required some additional procedures for doing a hair transplant in this region where um, uh, the mustache part was gone. This is the last case which I would like to show. An extensive debridement which happened because her face got um, dragged against the soil. It was more or less, almost most of them were abrasions. We cleaned it up, took a lot of time for debriding. As I said, they were deeper abrasions. We cleaned it, took lots of micro stitches to gather those abrasions together so that the wound starts healing, because the dermal and the epidermal parts come together nicely. And that is what we got, say around after 6 months, having given her lots of sun protection. These are the traumatic tattooing which you generally see. In spite of me doing lots of debridement under anesthesia, still there were contaminations and I could not remove them probably. So this micro dust particles lead to traumatic tattooing of this patient. And then she eventually healed. For these traumatic tattooing, we needed to expose her to some sessions of laser. The QSH NDI laser helps in removing these tattoo marks. And eventually at the end of around 2 years, she is looking pretty presentable and happy. So to conclude, these are the abrasions are most common physical injuries. With lot of them are simple and easily treatable. They are associated with other injuries. If not treated properly, they may lead to a disfigurement, scarring. The initial assessment by the treating doctor himself, good documentation, makes these injuries easily and better treatable. There is a medical legal angle to it which has to be considered, and it needs a lot of aftercare for getting better results. I request you to stay safe, follow social distancing. Thank you.